Hello guys, in this video we are going to see about the Laryngomalacia. Before we are going to enter into the Laryngomalacia disease, we have to know about the anatomy of the larynx. Larynx is extend from C3 to C6 cervical vertebra. Larynx contains a single unpaired of epiglottis and single thyroid cartilage and cricoid cartilage, and it contains three pair of cartilage, pair of arytenoid cartilage and pair of cuneiform cartilage and pair of corniculate cartilage. And in this larynx it contains vestibular fold and vocal fold. These two are forming vocal cord. Here you can easily see in the vestibular fold and vocal fold. Between the vestibular fold and vocal fold, it forms the sinus. This is the sinus of larynx or vestibule. Sorry, it's ventricle. Vestibule means above the level of the vestibular fold and below the level of the vocal cord is infraglottic. Above the level of the vestibular fold is otherwise called supraglottic. Between the vestibular fold and vocal fold is glottic, and below the level of the vocal fold is infraglottic. Here you can easily see above the level of the vestibular fold is supraglottic. Supraglottic contains epiglottis, aryepiglottic fold and arytenoids, and below the level of the vocal fold is infraglottic. It contains lower border of the cricoid cartilage. We already see the level. It starts from epiglottis to the lower border of the cricoid cartilage. And coming to the main, Laryngomalacia. It is the most common congenital abnormality of the larynx. It is characterized by excessive flaccidity of supraglottic larynx. I already showed to you supraglottic. Supraglottic contains epiglottis and aryepiglottic fold and interaryepiglottic, okay, which sucked in during inspiration, producing stridor and obstruction. Stridor increased on crying and subsides on placing the child in prone position. Why child? Because it's a congenital abnormality. The disease appears congenitally, but it disappears by 2 years of the age. In the direct laryngoscope shows, see, you can see the elongated epiglottis curled in itself. It's like omega in shape. This is a floppy arytenoid fold. It's a congenital abnormality and flaccidity of supraglottic larynx. So it leads to stridor. And we can easy diagnosis, we can use flexible laryngoscope. We can't diagnose in paralytic patient. The treatment is conservative treatment. If may required only, we can go to tracheostomy for respiratory obstruction. Thank you for watching.